Hello everyone, this is NainaMD right here in Beverly Hills. Welcome to my show, Fusion of Science and Beauty. And as you know, my passion is to bring anti-aging and regenerative medicine into evidence-based medicine, make you guys realize that this is truly a field that has emerged and it is very evidence-based. One of the treatments that I really want to talk about is the lack of libido. And you know that we use hormones, we use many things in medicines to try to address that. Sometimes it could be a medical issue, it could be medication side effects and so forth. But at the end of the day, there's still a lot of clients that I had that still had issues with their libido. And what better person to talk about it, because there could be another reason, and that's a psychological reason. She's a fabulous clinical sexologist, very well known in Beverly Hills. She has a PhD in clinical sexology. Her name is Dr. Judith Curts. Welcome to my show.
Thank you so much. And I'm so excited to talk about libido, which is sexual desire. And
Yes.
This is what people want to know about, but they're afraid to talk about it. So I'm so glad that you're opening this door.
I think we really did, because not only, you know, as a integrative anti-aging functional medicine is what I do, and in that we go beyond even what conventional medicine does, which is give drugs, right? Give
Correct.
drugs to get the erection, give drugs to get the sex drive going. There's still very little offered as far as women to help increase their libido. We know that there's certain hormones like testosterone. Normally, I don't give that just for libido alone.
Correct.
These women, there are sometimes women who test very low in that, and they're having a lot of other issues. And when we try to correct those imbalances, we notice that libido does improve. So it is a very important hormone in that. But there's so many times when we have addressed the hormones, we've addressed that sometimes patients are on certain medications that they have to be, and it might be causing a slowdown in their libido. But there's other issues, right?
Absolutely.
That's why I really would love to have you open up that door, because nobody gets it.
Well, that's what I do, and that's what I've been doing for 25 years in private practice. And I am so excited when I see a patient, when they finally get up the nerve to go see a sexologist.
Yes.
I'm also a board certified psychotherapist, so they could come to see me for anxiety, depression, whatever. But eventually, part of who we are is our sexuality. Yes. So we get to that point, and then we can start to rock and roll and talk about things. With libido or sex drive with men,
Yeah, let's talk about men first.
Men and women are so different, sexually,
yeah.
and men expect women to behave and to be sexual like they are. They are not. Let me tell you, they are not. So I try to tell, I see more men than I do women in my practice. But we can give a pill or something for men. Many times, though, I found it's guilt, it's messages that they've heard, travel, they could be exhausted, but many times guilt with men. That's a huge issue.
Really?
Really. And with women, you have to get to the head and the heart first. The genitals come last, but unless you have the head and the heart, it's not going to work. So I always send someone to a doctor for magic. If that works, fine. Many times they'll come back to see me, and that isn't the problem. It's still not working. I still have no desire. What do I do?
Yeah. See, women who sometimes get near menopausal, for example, they will, of course, that sex drive can go down, and you balance the hormones, and a lot of times it returns. But there's still a part of it that's saying, I don't care. I used to care about having sex. Now I don't care.
Right.
That's still a standard. And in spite of my balancing all the nutrients, all the hormones, everything. So I know that there's a psychological aspect to this. What is it? What
definitely.
happens?
Well, the first thing, and medically you can treat this, it's with vaginal dryness. You can get over, and you know, if it's hurting, you're not going to want to have fun.
Yeah.
Sometimes,
and that's treatable. That's easily treatable in my practice. I do that.
Easy stuff.
Yeah.
However, if women have blamed menopause, and I want you to know, you can have better sex after menopause, because you're not dealing with periods and all that.
I know,
kind
you
of
should
stuff.
be exactly.
And you should be having great sex until the day you die, maybe 5 minutes before the day you die.
Yeah.
But you should, and it is so healthy for you. It lowers the blood pressure, frequent sex, and it also is good for decreases heart attacks.
And also the endorphins are released.
And
the
the endorphins.
We need those endorphins.
But they get discouraged. And I think a woman, when she is going through menopause, psychologically, she thinks she's lost her femininity, which could be the furthest from the truth.
I think that's what it is. I think you've hit the nail on the head, because even when I balance everything, I think a lot of these women feel like that they're aging, and even though they try to go and get all the surgeries and everything done, there's a psychological aspect, and it's a psychological belief. It becomes a limited belief, doesn't it?
Right.
And so that limited belief has to be dealt with.
As women get older in our culture, which I think we're going to have to change this, because women get better as they get older, and they can be more sexual.
Sex should be much better after menopause, right?
Absolutely, and until the day we die. 5 minutes before, maybe we can stop having sex.
Yeah.
But it is good for us. It lowers the blood pressure. Frequent sex helps us to have less heart attacks, or any heart attacks, that and a glass of red wine.
Yeah.
But we really have to address how a woman feels about herself. She isn't going to want to get undressed and get hot and heavy with her lover if she's not feeling good about herself. And so the vaginal dryness, things going away, sometimes the breasts sag a little bit if they're not having surgery or whatever they want to do. And they're feeling that they're not feminine anymore.
I got it. So they feel that they're just not, they're lacking the femininity. So that's a psychological, becomes a limited belief.
They're not cherished.
Yeah.
And remember, I said we start with the head and the heart. And if you're not feeling good inside and you're not being cherished by your partner, also, as women age, it takes longer, men too, to get excited. And I always say a minimum of 20 minutes of foreplay. If you can't give 20 minutes to the relationship,
exactly.
I don't know.
Well, what about younger women? I'm seeing a lot of younger women coming in, and they're very ambitious, very driven.
They're exhausted.
But yet they don't. They don't want to. They're saying, "I don't care to have sex." What's the reason for that?
They have children. They're ambitious.
Some of them don't have children yet, and I'm even the younger in their 20s that are not married, but they've got very amazing boyfriends or marriages even that are young, but they're saying and they're very driven, but they're just not, and they love their husband or their boyfriend or their partner, but they're just not. The sex is.
What younger women tell me between 20 and 40, and believe me, I've had just a huge amount of women telling me this, and I hear the same thing. And the answer that they're giving me is intimacy. I know about sexuality, but sexuality without intimacy. That is, and I say oral sex, but oral is talking. Yeah. Talking to each other about sexuality, what you like, not just going and doing it. Men are okay with that, going and doing it and getting off, and they're fine with that. Women are not. And women want that relaxed time, that good time together, that I'm cherished, I'm cared for, so that they can rest a little bit. I think women have a tremendous amount of pressure on them today, but they are craving intimacy.
Wow. So it's just the intimacy that's just sometimes just not there, even in our young relationships.
Or talking to each other. One of my big pet peeves is, and you've got one in here, a computer, cell phones, we love our smartphones, but I see couples, because they're ambitious and they're returning text messages, they're not giving time to the relationship. And I think in relationships there should be a rule that at 7 o'clock all devices go off and we talk to each other for 30 minutes. We communicate. Men, young men are saying, women don't know what I want or what I would enjoy. And you've got to get to that point, instead of high T and low T, like testosterone, I call it trust. Yeah. High levels of trust, low levels of trust, where you really talk to each other and get your needs met. It's healthy for you. It's so much better for you.
Yeah. Wow, that's something for me to think about the intimacy issue. You would think young people are obviously more intimate, but that's not necessarily true, I guess.
They're not, and I'm hearing they're less intimate than they used to be because they are ambitious, because they do have their smartphones.
Well, from the medical point of view, we're saying they're adrenally fatigued. So they're like their adrenals in conventional medicine doesn't recognize this, but in integrative medicine we know that the adrenals are putting out the cortisol, right?
Right.
But at some points when your cortisol on demand
Right.
Exceeds the limit, so to speak. I didn't even nourish myself. I didn't even get to a point where I'm able to recuperate from all of this. It's just added stress. So I think stress then can be a huge cause of lack of libido and just not wanting to have sex.
And I think the millennials, which is
I think they're suffering
the
from
biggest
it big time.
group.
I think they suffer. I think there's an epidemic of millennials who don't want to have sex, even though the drugs and the everything. I think they're just looking for something to stimulate them.
They want instant gratification. They want that pill. They want the Viagra. And pink Viagra, that they call it for women, doesn't work. It's not proven to work. Female sexuality does not work like that. Yeah. But I can teach a woman how to get her libido back. If she hasn't had sex for a long time, what do I do, doctor? I haven't had it. I just don't want to. And I talk about self-pleasuring. And women have to masturbate.
Yeah.
And I usually tell them 2 or 3 times a week. They're all by themselves. They're not feeling bad about anything. But once you get it going again, you get the juices flowing, you get the fantasies going. And I also talk to my patients about their fantasies. Mm-hmm. Fantasies are there for a reason. They're there to heal and they're here to soothe. And once we can start talking about that, especially in my office, we can solve a lot of issues, and then they can start having some fun besides making money, which is a lot of fun. I'm not opposed to that.
Yeah. We're going to be right back. What's the website, by the way? They can
drjudithcurts.com.
Dr. Judith Curts, that's with a C-U-R-T-S, so Judith, J-U-D-I-T-H, C-U-R-T-S.com, or hit me up at NainaMD.com, and I'll tell you all about her. She's fabulous. We'll be right back with her after this break. NainaMD, Fusion of Science and Beauty. I'm NainaMD. You know, Peter Nygaard, the host, believes in anti-aging. He believes in anti-aging. I share that passion. Yes. So I'm a doctor who does so much anti-aging regenerative medicine. I talk about it. I interview people, and I am here today to find out the secrets of how people like you, the movers and shakers, stay so young and so healthy.
I'm not sure about that, but you do the best you can. You get enough exercise. You get enough. Not too much food. So intake and exercise. There's no mystery, and plenty of fluids, and get enough sleep if you can. And so the basics.
What are 2 foods that you absolutely have to eat every single day?
Foods. A fried egg and a pancake.
Getting personal.
A fried egg and a pancake. That's what I have for breakfast.
Seriously.
Yeah.
Seriously.
Okay. And then what?
Not too much. I need moderation.
That's it. That's the key thing.
Yes, I have 2 meals a day. That really is. If there's a tip, have 2 meals a day. You don't need 3 meals. I can get up from a half a meal and be satisfied. So you do not need as much food as generally.
And we know in anti-aging, by the way, caloric restriction keeps you healthy. It keeps everything going. It's been proven.
I would not be surprised.
Yeah. And one other thing, how do you keep so active in your brain? Your neurons are firing all the time. I can sense it.
I don't know the answer to that, except that work is one of the great things. Work gives you an
passion, right?
Sure, work gives you an opportunity to test yourself. Again, you have to learn new material every single time. You start at 0 and hope to get to 10 by the time you finish shooting it.
So that's brain is a muscle. So you're exercising your brain all the time, pretty much.
All the time.
There you go. That's the secret.
You
look fabulous.
It's not a secret, but it's one of the things. Thank you.
You look fabulous.
So do you. We're 25. Look.
All right. No.
This is Denise Grayson.
Nice to meet you too, Denise Grayson.
You look fabulous.
Thank you.
Yeah. I know what dress you're wearing. It's gorgeous.
It's mine. Thank you.
It's gorgeous. It's absolutely gorgeous. No. You know what? When you do yours,
it's mine.
Yes, there you go. That's what I love. This is mine too. Thank you so much.
Thank you.
Thank you. You're fabulous. You look
Thank you,
fabulous.
doctor.
Thank you.
See you later.
Hello everyone, welcome back to my show, NainaMD, Fusion of Science and Beauty, right here in Beverly Hills. I'm continuing with an amazing guest. Her name is Dr. Judith Curts. She's the very famous in Beverly Hills clinical sexologist. She has a PhD in psychotherapy. She's a certified psychotherapist, board certified. She's also has a clinical sexology PhD in clinical sexology. Amazing. And we were continuing with a discussion about libido. And men and women, young and old. Okay, let's focus a little bit on really, I think couples, as they're being given, we're really talking about many the new millennials, what advice we can start to give them, because more and more are under stress. Their ability to handle stress is not, I think, as like the older generation was. Okay, that's another issue, because they've been so inundated with so many things, the technology and all this, that I think the ability even to handle that physical stress is not like our older peers had it. So what can we do to try to restore intimacy? Because everything that we have right now, the technology, is getting us away from intimacy. Even the sex on the TV, the sex in the movies, the porn films, everything is just disconnecting us from the intimacy.
It absolutely is. And what we see on porn films, TV, that's not real. People acting, they're writhing and all. They're not acting. That's not real sexuality. That's a show for you to see, and you can say, well, gee, that woman was really excited when I did this or that, but she's not your woman. And I did my dissertation on baby boomer sexuality and women, and I got to the part of the fantasies and what turns women on. There's not one thing. It's across the board.
Really? It was across the board.
And so if you're not talking to your partner, you have to find out what she likes, what turns her on. Same with men, what would you like to do? And I always tell people, if you've got something that you want to do that you've been told, oh, that's really kinky, try it, talk about it. If you're in a safe, deep relationship, if you've just met somebody in a bar, I would suggest you don't think about it. That's just not the best thing for you or the healthiest. But I'm talking about relationships. And in my office, we talk about fantasies. Fantasies are there to help you with your sexuality, to heal you, to soothe you. And you can have a really bizarre fantasy, but it doesn't mean you're actually going to do that. But talking about it, and I suggest that couples start by reading bedtime stories. There's a book, a long time ago it was written. It's called Naughty Stories from A to Z, and they're just little short fantasies. Read them to each other at bedtime, but don't have sex at bedtime.
Got it.
Because that's when you're most tired. Plan other times, but you've got to talk about. You cannot expect to be sexual and for it to be just wonderful and fireworks if you haven't talked about it and if you don't know your partner intimately.
Right.
So you have to talk about those things.
Got it. What is, similarly, this is now young couples, what is for older couples? What is the advice and what that you can, what do we give them?
I love that question. That's a great question. Sometimes they do need hormones. Sometimes they do need Viagra. So we have to get rid of that shame.
After we get, after they've come
And men need it just as much as women do. So they have to talk about that and say, okay, we're getting a little older, but why can't we be rowdy and have a good time together? You can spark the relationship up a little with, again, fantasies, because very few people, talk about that. They won't share that. They're embarrassed. And older couples, baby boomers, were told that sex was kind of shameful and a bad thing, and they were raised that way.
I think also, let's touch on this subject now that we're on it, the shamefulness of sex. I think that's still prevalent as we're getting more global. I think there's a lot of other that are non-Western cultures that still look like that. That sexually, those societies, I feel, have that there is a lot of more, so to speak, shame in having sex. If it's not for the purpose of, let's say, a procreation and a stable family.
It's not just for pleasure.
Yes, it's not
just for fun.
And
for good health, and your skin is going to be better and your heart is going to be better. And you're going to feel better about yourself. You'll kind of walk with that special step.
Yeah.
In other cultures, absolutely, but even in the culture in the United States, we have allowed men to define female sexuality. We've had male physicians primarily. We have had men who said, well, this is how you're supposed to be, and this is what you're supposed to do. That's wrong. So now women are finally, and I'm saying through self-pleasuring, through really looking and talking, they're learning that their sexuality is just fine, and it's very normal for them, but they have to share that. And then you have a better relationship when you're equal and sharing. But when you're under somebody's thumb and they're telling you what you should think and what you should feel and you should do this or that, it's totally dysfunctional, and you're not going to get anywhere that way.
So that means there's a lot of societies then that are under the male thumb, so to speak, right?
And I've said, you know, why would men want to give up the throne? They've been on the throne for so long. I adore men. I have sons. I adore men. So I'm not saying that in a negative way.
No, I understand.
But I think it gives men tremendous freedom to give up that authority over a female sexuality. I think it really helps them. And I have had more men come into my office who will say, it thrills me to please my partner. It excites me. I want to please her.
That's amazing.
With older couples, men with prostate issues, and they may not be sexual for a while, or we all get sick, unfortunately, occasionally, and we're not feeling sexual, but we have to be aware of our partner's sexuality, and sometimes sex therapy can help you through that. Sex therapy doesn't mean there's something wrong with you. It means there's something right with you, that you said, I just want to make my life better. I want to talk.
That's a really different concept. That's amazing.
What do you think about it?
I think absolutely. Sex is a very integral part, but it's a perception. I think in today's world, I think the perception of sex is causing us to detach and lose our intimacy. So yes, sex to me means intimacy. So sex without intimacy is very difficult, and a lot of people are opting for that.
It's just doing the deed.
Yeah.
And I mean, people can certainly do that, no judgment here.
Yeah.
But when they do, it does not please women as much, and that's why they're saying, I don't care anymore.
Yeah.
Not interested.
The transgenders. As you know, I know we may do another show for that, but at least let's touch on that. We have to, because this is becoming a very concern of mine. I think there's so many transgenders that have spent so much, there's so much emotional turmoil. They've spent money, and they've gone through so much personal, strength. They've had to use their personal strength, everything, to get to be recognized that, you know what, we're transgenders, we need to be respected. And we have our rights as well. Having said that, I of course focus on that. I feel many of them are being ignored in terms of their hormones. I use bioidenticals, so I think there's safer approaches. I don't like the fact that transgenders are sometimes not educated, and so they spend all of this effort and then only to maybe have an illness that comes about because of something, as a side effect of something, so to speak, of the therapies. Having said that, that's my role. But your role is how do they go through with their partners?
You've hit a hot button with me. A few months ago, I spent a weekend with a group of transgenders. Not any famous transgenders, but some famous surgeons came in. Dr. Marcy Bowers, who is internationally known for doing surgery, transgender surgery, and then with some surgeons who will do the shave the Adam's apple, give the face feminization. However, that's all pretty expensive, and not everyone, that's what the group was telling me, they can't afford it. So how do we do that? And I talked to them about their sexuality. Has that changed? Generally, it doesn't. What? Sexual orientation is there from the beginning, so you have to kind of integrate that, and that's where you work with a sex therapist. Many times they don't do that. They would rather spend the money on having the Adam's apple shaved or the feminization of the face. But the big piece that's missing is the sexual orientation. And if sexual orientation doesn't change, what turns you on doesn't change. And that's put into our head when we're 4 or 5 years old during our psychosexual development. And that's why, well, fantasies and what turns us on is 4 or 5 years old.
Seriously.
But orientation begins at birth.
Wow.
Yeah. So we have to look at that and see, even though they may change, we have to look at what really turns them on, what they really want, what their orientation is. I think it's a huge piece. There's a show on I Am Kate, which I love because it's giving information. And I think she's doing a pretty responsible job with it. It's, yes, it's all about the glamour. But
Yeah. So, wow, I didn't even think of that. That's really interesting. So tell me a little bit about your practice. Are you like 7 days a week, 5 days a week? Because I know you have a radio show.
I do. I have
What's
a
the radio show? What's the name of the radio show?
That's on tomorrow. It's called the Doc and Doc Show. I'm on with a physician in Valencia. He was chief of staff twice at Henry Mayo Hospital. It's a local show in Valencia, and he does the medical part, and I do the psychosexual.
When does it air?
2 o'clock in the afternoon every Wednesday.
Every Wednesday too. Yeah, we'll
And
have to watch
people
that.
call in, and we don't hold anything back. We have a great time, and the music when the show comes on is James Brown. I feel good.
Fabulous. And your website is Dr. Judith Curts?
Yes.
That's with a C. So Judith CURTS.
Yes.
.com.
And I have an office in Valencia, and then, of course, I concentrate my office here in Beverly Hills.
Yes, she's one of the hidden secrets here. Well, everyone knows about her, but it's phenomenal. All my patients, I would refer to you, and because of just your knowledge base and your experience. Thank you so much for coming on my show. This is not the last one, by the way, you're coming on.
I hope not. We're having a good time.
We're having a good time. So thanks again. We're going to be back next week with another great show right here at NainaMD, Fusion of Science and Beauty in Beverly Hills.